Good afternoon. Welcome to today's program, Deepening the Treatment Paradigm. I'm Julie Miller, Editor-in-Chief of Addiction Professional. Today's program is a Foundations Recovery Network webinar sponsored by Vallejo Resources Behavioral Health Recruiting. Thank you to our sponsors and to everyone in our audience today for joining us. Before we get started, we do have a few details that we would like to review with you. You'll notice that each window on your screen can be moved by clicking and dragging, or you can enlarge and minimize the windows by clicking on the icons in the top right corner. Please use the Q&A area to the right of the slides to submit a question at any time. You don't have to wait until the end of the presentation. But if you can't see this area, just click on the red Q&A button. Also, to download a copy of today's presentation, please click on the link in the resources area in the lower left of your screen. And if you have any technical issues at all during the program, please just click the yellow help button and we can help you troubleshoot the issue. And a special note about CE credit. To receive credit for today's program, you must click on the green CE certificate at the conclusion of the program and complete the evaluation form. If you're watching today's program in a group, please download the group submission guide and the program evaluation, which are located in today's resources list, and follow the instructions. If you have any issues with this process, we ask that you don't reach out to today's sponsor as they will not be able to help you with your certificate. Please note that CE credit is not available for the archived webinar. It is only available for the live event today. Finally, you can also tweet during today's webinar by clicking on the blue Twitter icon at the bottom of your screen. Simply click the Post and Authorize buttons, log into your Twitter account, and begin sharing automatically at the event hashtag #APLiveWebinar. At this time, it's my pleasure to introduce our speaker for today, TJ Woodward. TJ is a spiritual care counselor for Foundation San Francisco, an inspirational speaker, and an addiction counselor who has helped countless people. He is the founding spiritual director of Awakened Living in San Francisco, and additionally, he is in private practice as a spiritual counselor and awakening coach. His book, Conscious Being, Awakening to Your True Nature, is an insightful guide for rediscovering your essential nature and living an intentional and awakened life. TJ, thanks so much for taking the time to speak with us today, and with that, I will turn the audience over to you.
Great. Thank you, Julie, so much. It's such an honor to be here, and I am really grateful to be exploring today our topic, Deepening the Treatment Paradigm. So to begin, I want to reference or talk about what I see as the current treatment paradigm and then give a kind of an overview of what we're going to be covering in today's webinar. So in the current treatment paradigm, we as clinicians so often treat symptoms without looking deeper into the root causes of addiction. In my experience, in my many years of working in the addiction field, I recognize that many programs use a cookie-cutter or a one-size-fits-all approach to treatment. The industry standard has been to view treatment as triaging acute needs and then developing extensive aftercare plans. And I recognize that this approach is highly effective with many of our patients, maybe even the majority of our patients. But what we're going to be talking about today is what about the chronic relapsers who present to our programs often multiple times, 1, 2, 3, sometimes 4 times returning to treatment after chronic relapse. We may need to ask ourselves what we can do better to address underlying issues that drive these addictive behaviors in these acute cases of the chronic relapser. Whether it's unresolved trauma, attachment issues, or spiritual disconnection, these challenges really need to be dealt with for these patients if they are going to achieve lasting recovery. So the objectives for today's webinar are to discuss the role of authenticity and vulnerability in the treatment process and therapeutic relationship, identifying methods to help our patients dismantle core false beliefs that are keeping them stuck in a pattern of relapse and hopelessness, and also to consider reparative interventions that will have a lasting positive impact on our patients and, of course, on their families. So let's explore. Some of what we're going to be exploring today in the webinar are some techniques and practices that will not only address the behavior of our patients, but will also assist those patients in breaking free of lifelong destructive patterns. And also, we are going to explore effective approaches in creating a safe space for them to go deeper into the core material trapped in their subconscious and empower them to connect with their deepest truths. And that really is the foundation of my work, looking at addiction through the spiritual lens. So I'm so incredibly grateful we're going to be delving in and exploring these topics today. A little bit about me. Julie already introduced me, but I am the spiritual care counselor at Foundation's Intensive Outpatient Program in San Francisco. I've been working off and on in the addiction field for 25 years, but primarily for the last 8 or 9 years working full-time in this field. I'm also the host of Awaken Living TV and Awaken Living Radio and the founding spiritual director of Awaken Living Spiritual Community in San Francisco. And as Julie mentioned, I recently published my book, Conscious Being, and I talk in that book about spiritual awakening and consciousness. And I also, of course, write a lot about addiction and the role of spirituality in both addiction and in addiction recovery. So this is the lineup for today. Beginning on the upper left, we're going to be discussing what it means to look at addiction through the spiritual lens, or what I call looking at addiction through the spiritual lens. Some of the topics we'll be covering there are the fragmented self, developing strategies for survival, and assisting our clients with integration. We will then move into discussing symptoms and root causes, and again, looking at a lot of times in some programs, we're looking at behavior and symptoms without always going down to the root causes. So we're going to talk about how we identify the symptoms and then move toward root causes. And we're going to be talking about toxic shame, unresolved trauma, and spiritual disconnection. And to me, those are 3 of the root causes that I see repeatedly in our clients that are presenting multiple times to treatment. Then we're going to be moving into how we address those underlying issues once we have identified those and moved from symptoms into root causes. We're going to be talking about what it means to create and hold a space for our clients to go deeper. We're going to be discussing the role of authenticity and vulnerability in the therapeutic relationship and in our treatment paradigm. And then we're going to be talking about how we can help our clients and our patients dismantle some of the core false beliefs that they're carrying around. And that's a topic I really love talking about. In my experience, so many of our patients are walking around with some really negative core false beliefs that when we can assist them in addressing those, they can have such an instant experience of freedom. And then finally, we're going to be talking about really one of my favorite topics, and that is doing our own work, our own inner work as clinicians. And to me, that's really kind of what this entire webinar really is about, and that is how each of us go deeper into our own inner work so that we can be a presence to assist our patients in doing the same. So let's begin by looking at addiction through the spiritual lens, and I'll be addressing what that means to me and looking at it through the spiritual lens. I'm so blessed to be the spiritual care counselor at Foundation's IOP and being able to look through the spiritual lens. And as we know, there are multiple aspects to treating addiction: physical, mental, emotional, and spiritual. Holistic integrated treatment addresses all 4 aspects, and I'm so grateful and so blessed that I get to work with our patients looking at this through the spiritual lens. And so today what we are going to explore is the spiritual aspect of both addiction and treatment. And what I mean by spirituality is I want to offer a framework here of what I mean by looking through the spiritual lens. In my experience of working with a lot of patients over the years, and certainly in my own life, it seems to me that we come into this world what I call whole and perfect. And I know that terminology doesn't work for everyone, but what I mean by that is we come into this world absolutely connected with our true nature. So whether we call that true nature God, the universe, source, spirit, etc., what we know is when we look at a small child, in particular a child under the age of 5, we recognize that they have a connection with themselves. They're absolutely connected with their essential self and with their emotions. As we know, a young child will absolutely be present with whatever they're feeling, and they will certainly let us know that. And then something happens. Don Miguel Ruiz in his book, The Four Agreements, calls it the domestication of the human. And I love that. And so viewing addiction through the spiritual lens means recognizing that through this domestication, as we could call it, or through traumatic events, or through really living in a world that doesn't always honor us being present with our own feelings, there's a separation from that true self, and often, of course, at a very early age. So our role as clinicians, looking at addiction through the spiritual lens, is to assist our patients in integrating back to wholeness and reconnecting with a sense of love and purpose, or a sense of presence, returning to that state of awe and wonder about life rather than being stuck in this sense of a separate self. So that moves us right into the conversation of what I mean by the fragmented self. Of course, many of us are familiar with attachment theory, and attachment theory tells us that an infant needs to develop a relationship with at least one caregiver for the child's successful social and emotional development, and in particular for learning how to effectively regulate feelings, which is what I addressed a moment ago. Children are very in touch with their feelings, but when there's a separation or they're not able to attach with one of their primary caregivers, the ability to regulate emotions becomes distorted. And I know for those of us who have worked in this field for some time, it is something we see recurring, with our patients, and an inability to be present with their emotions, to regulate those emotions, and to actually connect with them. So as a result of overt or covert abuse, whether it's sexual, physical, emotional, and neglect, there is a closing off or separation that actually inhibits a person's ability to develop basic trust in their caregivers, and more importantly, in their self, which is how we become, or how they become, a fragmented self rather than a holistic or a whole person. And this, of course, often leads to addictive patterns later in life. And for those of us who have been in this field for some time, this, I think, is at the core of what drives chronic relapse and people staying stuck in these addictive patterns. So many of our patients who present to our programs didn't receive the love and connection they needed growing up. And so I say, they're in pieces is the way I frame it, or they experience themselves as a fragmented self. So consciously or unconsciously, many parents, teachers, and caregivers weren't able or willing to provide the presence, love, and support that these young people needed in order to thrive. So the addictive pattern, that separation from self, often is at the core of what drives addiction later in life. So we're going to be talking now about developing strategies for survival, looking at our patients who early in life have suffered some sort of trauma or simply domestication, as I mentioned. There is a fragmented self, and then there are strategies that our patients develop in order to survive. I call these brilliant strategies, and I want to speak to that because, due to separation or this inability to attach to primary caregivers, our patients do develop strategies for survival, and these are often called coping mechanisms. One day I woke up and realized that we have been framing, many clinicians and therapists, refer to coping mechanisms, but there's some sort of negative connotation that shows up when we call them coping mechanisms. And I woke up one day and I thought, what if I assisted my patients and my clients to reframing these and recognizing that they're actually, at the time, they were incredibly brilliant. So for me, it's useful to assist our patients in reframing these as brilliant strategies because they actually were brilliant at the time, and in many cases, quite literally saved their lives. Of course, what we know is the issue is that these strategies have become maladaptive. So assisting clients in reframing these and recognizing the actual brilliance of the original strategy is, I think, far more effective than framing them as coping mechanisms, because at that point, we're identifying that there's something wrong with using this coping mechanism. I have seen profound changes in my clients when I'm able to assist them in seeing them as brilliant yet maladaptive. Because at this point, then we recognize, wow, I actually have a choice. I can choose to, reframe and maybe move beyond these strategies that were once brilliant but no longer serve me. So our work as clinicians really is to assist patients in discovering and dismantling those strategies that keep them trapped in addictive patterns. So how do we assist our clients with integration? In individual or group settings, what I recognize that we as clinicians have a wide spectrum of choices in how we facilitate the therapeutic process. So whether we're meeting with a client individually or we're facilitating a group, I recognize that we have many choices. In my own experience early in my work in this field, I found that I was coming in with a very clear agenda, and whether I probably wouldn't have admitted it at the time or even recognized it, but I really was kind of forcing an agenda. And what I have discovered is that we can actually be a field of presence which allows our client or patient to explore their own journey. In this paradigm, we actually see ourselves gently steering the process rather than over-asserting our will. And the analogy I use, that's why you see the little boat icon. I don't know if you can see it there, but we have a choice. And the way I picture it in my own mind is I imagine that, I'm helping this patient steer their own boat, if you will. And I can put that motorboat in and really use force, or I can see myself as gently steering and allowing the river itself to lead the client. And what I mean by that is allow the patient to actually have more the ability to actually run their own, steer their own course. That's certainly true in group as well. Allowing myself to see myself as someone gently steering that process rather than feeling like I need to have the agenda and I need to make it happen. So we move from making it happen to creating a space, or what I would call a field of presence, and allowing that to emerge. Much more organic way of being. So we're going to talk now about symptoms and root causes. So this next section of the webinar is really identifying some of these root causes. We're going to get to some of the treatments that are effective after this, but first it's important to identify some of these symptoms and root causes. So many modalities of treatment and therapy focus on behavior. And as I previously mentioned, they are incredibly useful reparative interventions for many, you might even say most of our clients. But what about the chronic relapser? What about our patients that are presenting, as I said earlier, for multiple treatment episodes? What about those relapsers who are experiencing toxic shame, have unresolved trauma, or are experiencing a deep sense of spiritual disconnection? Most likely, a patient who is a chronic relapser has had at least one or maybe two or all three of these as underlying issues that really do keep them stuck in a pattern of self-destructive behavior. The treatment for these always starts with the same intervention in my work and in my estimation, and that is creating the space by being a field of presence, as we just discussed. So let's start by addressing toxic shame. This is a quote from John Bradshaw, Healing the Shame That Binds You, of course, as we know, is a pioneer in the field of shame and how we work with and assist our patients in moving out of a toxically shame-based reality. So I'll read this quote from John Bradshaw. Toxically shamed people tend to become more and more stagnant as life goes on. They live in a guarded, secretive, and defensive way. They try to be more than human, perfect and controlling, or less than human, losing interest in life or stagnated in some addictive behavior. So guilt versus shame. I know a lot of us have a clear understanding of this, but I like to say it really simply because the intervention for how we work with guilt and shame are very different, and sometimes our patients aren't able to identify or recognize the difference. So the way I frame it with patients, and it seems to be really effective, is to simply say guilt is I've done something wrong, while shame is I am wrong, or there's something wrong with me. And of course, in many spiritual practices, including 12-step programs, there is a strong focus on making amends. And it's, of course, a wonderful technique or remedy for dealing with guilt, because it actually allows a person to clean up the mistakes of their past. But that really doesn't address the deeper underlying issues of toxic shame. So we know that not everyone who's experiencing guilt or maybe has felt like they've done something wrong is experiencing a deeper level of shame. But what we know is if someone's coming from a deep sense of shame, actually recommending someone go and make amends for that may be exactly the opposite of what they need. Shame is something very different. We need to create an incredibly safe space for our patients to be able to identify and address the shame and bring it into the light so that it moves out of the shadow and into the light of awareness. So some of the symptoms of shame, and we could certainly all add more to this list, but here are a few that I came up with. Sexual compulsivity, grandiosity, low self-esteem, and depression. And again, those are just a few of the symptoms of shame. So let's move now into unresolved trauma, which is also one of what I see as one of the root issues or the root causes of addictive behavior in our patients that are presenting for multiple times or who are chronic relapsers. So this is a quote from Susan Pease Barrett. I hope I'm getting that name right, Bannett, from the Trauma Toolkit, and I'll read this quote. Traumatic events, by definition, overwhelm our ability to cope. When the mind becomes flooded with emotion, a circuit breaker is thrown that allows us to survive the experience fairly intact. That is, without becoming psychotic or frying out one of the brain centers. The cost of this blown circuit is emotion frozen within the body. In other words, we often unconsciously stop feeling our trauma pathway into it, like a movie that is still going after the sound has been turned off. We cannot heal until we move fully through that trauma, including all the feelings of that event. And I know that anyone who's here today that is a trauma expert, I know there's a lot of different approaches for how we work with trauma. And I think it's important in working with trauma that we open up the conversation now to recognizing that it's important when treating our patients with trauma that it can be an incredibly complex issue that may require partnering with experts who specialize in trauma. So, of course, what we know, some effective modalities that assist our patients with trauma are EMDR, somatic experiencing, mindfulness-based therapies, and attachment theory specialists. One of the things I'm so incredibly grateful for in working at Foundation San Francisco IOP is that we really have an incredibly extensive network of partners that we work with, different therapists in our community that have different specialties. And so what I'm going to say about working with trauma that I think is really fundamental in my experience is I often see that we're not connecting our patients with these experts early in the treatment episode, and then this results in very little time to create a safe space needed before reintegrating them into their daily lives. In other words, we're waiting, often until toward the end of a treatment episode, and what we know about someone who has extensive trauma or complex trauma in their history is that safety and connection are the most important aspects. So are we serving our patients by waiting till toward the end of the treatment episode? And then I've seen in some programs I've been in, certainly not Foundation San Francisco, of course, but in some programs I've seen kind of like a scrambling toward the end of the treatment episode to try to get them connected with these experts in trauma. And what we need to do, in my estimation, is develop these relationships early on so that they are seeing a trauma specialist concurrently while in our programs so that we can do a really warm handoff, if you will, into private practice as they graduate from our programs. This, to me, is fundamental, and it seems like a really simple way of addressing this issue. And I'm going to just say, the last part here is that, as I said, the most effective strategy to me includes partnering early on and collaborating throughout the treatment episode rather than waiting till the end. And I think that's, so that we can create safety, we can work with the specialist, and we can really develop a way to help this patient be held in a really powerful way. So some of the symptoms of trauma, and of course, again, we could add to this list, eating disorders or body dysmorphia, low self-esteem, lack of purpose and direction, and attractive to abusive or distant partners. Those are just a few of the symptoms of someone who had unresolved trauma. So let's talk now about the third aspect I want to address as a potential underlying issue for chronic relapse, and that is spiritual disconnection. This quote is from my book, Conscious Being. Of course, I have to take a moment to self-promote, but I feel like it's the perfect quote for this conversation about how spiritual disconnection can often drive destructive and addictive behavior. And so I'll read the quote from my book. All addictive behavior stems from our inability to recognize our inherent wholeness and the belief that something outside of us can return us to a feeling of peace and comfort. It is as though we have our own umbilical cord in our hand trying to find a place to plug it in an attempt to reconnect with ourselves. So I want to take a few minutes to talk about my own story. I think it's important for me at this point to recognize why I have the passion that I do for this work, and the work I'm referring to as assisting patients in reconnecting with their essential self, or moving beyond this spiritual disconnection, this sense of emptiness. And in my own journey, at the age 7, I actually closed off, and I have a distinct memory of being in my living room at age 7, and I can remember it like it was yesterday. My mother and my 2 sisters were at the dining room table, and I began to feel a physical sensation of closing off. And I remember at the time, my young mind, I'm not sure what a 7-year-old mind would possibly say about that, or even how I would make sense of that, but I remember a felt sense that it wasn't safe. So my strategy at the time, which of course, as we know, I've now reframed as a brilliant strategy, was to close off and to shut down. And this really was actually quite brilliant at the time, because in truth, it really wasn't safe in my home emotionally. And so I really closed off at a very early age. From age 7 to 14, I walked around with that sense of disconnection, that sense of emptiness, with all these barriers around my heart. And so addiction for me became the solution, or really I could say actually drugs and alcohol became the solution at age 14, and I had an experience of so much relief. So when working with patients, I recognize that part of the work that I do is helping them to reframe, not looking at addiction or drugs or alcohol as the enemy, because it was actually a brilliant solution in my life. The problem, as we know, either in our own journeys or in working with our patients, is that the addiction or the drugs and alcohol, which were once a brilliant solution, become the problem. So in my own journey, the last 2 years of my addiction, when I was 19 and 20 years old, I really was on this search, this low-level search for spiritual connection, and I was becoming more and more empty. And at the age of 20, just about 50 days before my 21st birthday, ironically, I did get clean and sober. And I would love to say that's the end of my journey, right? So I got sober and everything was wonderful. And, this is why I think it's really important to talk about my own story at this point, because it actually really frames the way I work with patients. We often will work with patients that put down the drugs and alcohol, and then they say, why isn't everything getting better? And so helping our patients to reframe that as recognizing that drugs and alcohol aren't the problem, they actually were the solution to the problem, and they quit working, just like those other brilliant strategies. And so in my own journey, getting sober was only the beginning of me waking up and reconnecting to my essential self. And so throughout my 20s and throughout my 30s, I was still on this constant outward search of trying to fix something from the outside in. And that's why I use the example of having the umbilical cord in our hand trying to plug in. I had absolutely abandoned myself. And so we will hear sometimes in 12-step recovery in particular that the God-shaped hole, and I know many of us have heard that, and what that's referring to is that we're walking around with this sense of emptiness within, or this hole within ourselves that only God can fill. And I want to offer a little different perspective on this. Because when we say to our patients that we have this hole inside of us that only God can fill, we may be unconsciously perpetuating the same seeking. So if someone has an idea that there's a God out there, and if I can just connect with this God, I will heal this hole inside, I don't know if that's serving our clients. And so what I want to say about that is, in my own journey and in the work I do with patients, it is important, and it was important for me to recognize on some level that I had this sense of emptiness inside, and I needed to work with that and recognize that's something that I needed to learn how to be in the world with and have that healed, rather than thinking there's some type of God or higher power out there that needed to fill that up. And I think it's really important to say that, because it's a very different framework in terms of outward seeking, because we can inadvertently perpetuate that same cycle of there's some place to plug in out there. So I thought it was important to say that. So some symptoms of spiritual disconnection, and of course, as I said about the last two, we could certainly add to this list. But some of the symptoms are a lack of purpose, low self-esteem, as I already mentioned, seeking outward validation. That could be jobs, money, relationships, sex, gambling, any kind of addiction, or anything outside of ourselves that we're trying to fix some sort of inner malady. And then codependent and addictive relationships. So we're going to move now into how we address these underlying issues now that we've identified them. And of course, we know that there might be other underlying issues as well. But these three that I just addressed seem to be at the root of what drives so much of this addictive and destructive behavior. So this quote is from Judith Lewis Herman from the book Trauma and Recovery. Recovery unfolds in 3 stages. The central task of the first stage is the establishment of safety. The central task of the second stage is remembrance and mourning. The central focus of the third stage is reconnection with ordinary life. And why this really stood out to me is a recognition that for many of us who are working in the treatment field, and we're talking about deepening the treatment paradigm, it is primarily this first stage that what we're doing with our patients, we're really helping them to establish a sense of safety. And as I mentioned before, that often means partnering with outside therapists to create the safety that they need so that they can move into the second stage of healing. So how do we resolve these underlying issues? To me, there are 3 very effective methodologies that have proven to be highly effective interventions and really can assist our clients and our patients in permanently breaking free of their underlying issues and shift into a life of contentment. And I know that's a strong statement, saying permanently break free. And I'm holding to that because I have seen powerful and profound shifts that have happened in patients that I've worked with and patients we've worked with at Foundations IOP, simply by using one or a combination of these 3 modalities or methodologies. One is creating and holding the space. The second one is the use of the power, recognizing the power of authenticity and vulnerability. And the third one is uncovering core false beliefs. So let's talk about what I mean, or what we mean, when we talk about creating and holding a space. This is from Alice Miller, The Drama of the Gifted Child, which was one of my favorite books in the 80s. And the quote is this: "Experience has taught us that we have only one enduring weapon in our struggle against mental illness, the emotional discovery and emotional acceptance of the truth in the individual and unique history of our childhood. So what do we mean when we say holding the space? And this is the way I frame this, and this is really about holding the space through the spiritual lens. Holding the space, for me, involves seeing our patients as inherently whole and perfect, rather than viewing them as their diagnosis. Powerful shifts can happen when we view the patient through this spiritual lens. And I really want to address this because this is a conversation that I've been in for many years. I have seen powerful shifts happen in patients when I simply bring awareness to that part of them that is whole, that is inherently whole and perfect. So rather than saying they are depressed, they are bipolar, we look at them, or I look at them as they have that. That is a symptom, but it's not the whole truth of who they are. I think we potentially do a disservice to our clients when we view them as fundamentally broken, rather than opening up to the possibility that their symptoms really are a smoke screen of maladaptive strategies, which is what we talked about before. So when I can see beyond the strategy or the symptoms or the diagnosis and look at them, what's underneath them, and see what's underneath that, and see that inherent wholeness and perfection, profound shifts have happened. So creating this type of non-judgmental, open-hearted space really involves doing our own deeper inner work, which I'm going to address. I want to tell a really brief story about this and how this has become such a fundamental part of my work. My first job in this field, I was a residential counselor, and I would often be called in when clients were having, acute emotional distress, let's put it that way. For those of us who work or have worked in residential treatment, we know that this is quite often at least a daily event when one of our patients reaches that place of they just can't go any further, or they have, some sort of emotional distress. It often shows up in, I need to get out of here, I need to get out of here now. And of course, that's the PG version. We know what they're really screaming. So I was often one that would be called in these times of extreme distress. And there was a woman who needed to get out of there, and I sat with her, and her primary therapist asked me to come in and, can you sit with this patient and see what's going on? After an hour of being with her, there was a profound shift that happened, and she was able to, become more present. She had the real emotion underneath the anger and the rage, which was sadness and loss. And after the experience, the primary therapist said to me, what did you do? What did you say? And it was at that moment I recognized that it wasn't about what I said or what I did. It was about creating a space for that client so that she could have a safe space to go into these underlying emotions rather than being kind of stuck on what might be called symptoms, right? So it was a very, very powerful experience for me, and it really shifted the way I work with patients permanently. So let's talk about authenticity and vulnerability and the power of that in our work. Of course, we know Brené Brown now has become, the expert in vulnerability and how we can use vulnerability in our own lives to have powerful shifts, both in our personal life and in how we work with patients. So this is a quote from her book, The Gifts of Imperfection. Authenticity is a collection of choices that we have to make every day. It's about the choice to show up and be real, the choice to be honest, the choice to let our true selves be seen. So I want to talk a bit about the therapeutic relationship and how authenticity and vulnerability can assist us in creating this safe space for our patients to do this deeper inner work. Of course, the recent work of Brené Brown is showing us that the power of authenticity and vulnerability and how powerful that could be in the therapeutic process. As clinicians, it is important that we are authentically engaged in the process. Another way to say that is we bring ourselves into the room. And to me, this is one of the most powerful ways we can create a safe therapeutic alliance. And what I mean by bringing ourselves into the room is that we allow ourselves to have an appropriate emotional response for our clients' processes. Oftentimes, they have never been in the presence of someone that is deeply engaged and present in their own process, and we can actually model this for our patients in a very powerful way. For example, we may reflect back to our patients that something we're hearing elicits a particular emotional response, like from us, like, I feel sad when I hear you saying that. And of course, we have to use this, and we have to be really careful about the way we use it, because we don't want to bring our own stuff into the room, or our own resolved issues, but being this field of presence and having an appropriate emotional response to what they're saying can be an incredibly effective way to assist our clients. I want to talk a bit about self-disclosure, because sometimes, and I want to be careful the way I say this, sometimes a bit of self-disclosure can be appropriate. And I know that, this was for many years considered absolutely off limits, that we wouldn't bring ourselves into the room and talk about our own journeys. And it's now we're now showing or seeing that used artfully and sparingly, this can be an incredibly powerful therapeutic process that will assist our patients. For example, I will sometimes share with the patient how I once carried around negative core false beliefs stemming from some experiences in my own childhood. And I would not share the experience, and I would not necessarily, or probably would not share the negative core false beliefs, but I would let them know that I had this too, this experience, and then I would share how I overcame that. And I think that this helps them to have hope, quite frankly. There's something really powerful in recognizing that there is hope in knowing that they're not alone, and that there are those of us who have walked through this before them. And so, we need to be careful to use this appropriately, and it can really offer a great deal of hope to our patients. I've also seen it used, in my estimation, gone too far, where people are sharing details about their past, and that doesn't seem appropriate or useful. That sharing with them in a general way, especially about the way that we walked through that and worked through that, has been incredibly useful. So the third modality I want to talk about is assisting our patients in uncovering core false beliefs. This is a simple quote from Carl Jung: "Until you make the unconscious conscious, it will direct your life, and you will call it fate." I want to talk a little bit about the I am. In my work in ministry and in my work in a spiritual community, we talk a lot about the I am and how important where we put our I am is. In our patients, what I see, it's really clear to me that people who suffer from addiction often carry very dense negative core false beliefs that usually start with I am something, such as I am not good enough, I am not lovable, I am not worthy. So most of our patients don't even realize this is happening, and it's really trapped deeply in their subconscious, and therefore, as Carl Jung said, it is directing their lives. So what we are to do to assist our patients is to help them uncover this core material and bring it into the light, so that they can recognize their choosing rather than having that unconscious or subconscious running the show. And this is an incredibly effective and powerful tool that really, this is where I talk about seeing instantly positive results. It's really revolutionary for many of our patients to see this in a way that they've never even recognized that they're carrying around these core false beliefs. The Disney movie that just came out, Inside Out, if you haven't seen Inside Out, it is such an incredible movie that speaks in such a brilliant way to this. And it's actually profoundly emotional for me to recognize that children, and of course children of all ages, because I love this movie as well, are being offered this framework of how we do store these core beliefs deep in our subconscious. And we actually use it as a tool at Foundation San Francisco, and our patients really, really love this movie because they get to see that they are carrying around these negative core false beliefs without knowing it. So a lot of my work in helping people to move beyond these core false beliefs is self-parenting. And of course, we know self-parenting involves teaching our clients or modeling for our patients how to dialogue with that wounded inner child. And for me, I like to keep it very simple with my patients, and that is, through a meditative process, helping them get back to some of these events those original events of separation and see if they can identify some of these core false beliefs and then recognize what we call brilliant strategies. And when we move beyond strategies, they recognize that there's still this wounded self that they're carrying around deep in, their subconscious. And so I offer them, once we get to that point where they recognize and understand this framework, this idea of self-parenting can be incredibly powerful. And so I offer them, as they're speaking to that wounded part of themselves, to say these three things. It is okay to feel that way. It is safe now, or you are safe now, and I'm here for you. Because what we know about trauma, spiritual disconnection, and shame is that most of our patients that have experienced that have never or very rarely were ever told it's okay to feel that way. That's revolutionary for our patients, because many of them are still trying to use techniques that they may think are useful to try to change behavior that can actually be concretizing shame. So beginning by assisting them in that inner dialogue of it's okay to feel that way is very powerful. They create safety for themselves and, of course, in community. And then, of course, I am here for you. I'm not going to abandon myself. The adult part of me is learning now how to be here for that wounded part. This obviously is a process that it can happen in such a powerful way, really, or even early on in the treatment episode. Again, for those patients that continue to relapse, I think it helps us, or it behooves us, to go deeper with them earlier on. So assisting our patients in learning how to reparent using positive self-talk and self-love can assist them in identifying and dislodging some of these core false beliefs. So unlearning is an important concept, and I actually share that transparently with my patients. I share that, I know you're in treatment and I know you're learning a lot and you're getting a lot of tools, and at some point, a big part of this process is actually unlearning. So this is about unlearning rather than learning, and unlearning those negative core false beliefs, those strategies, letting go of the way that we've always been in the world, or simply said, nothing changes if nothing changes. And the way I say it is experiencing ourselves as love is the most natural thing in the world. And the path to remembering ourselves as love is one of dismantling or unlearning everything that we've been taught that contradicts that truth. I've seen really powerful transformations in patients. So finally, where we're landing in this webinar today is I want to spend the few minutes we have left, talking about doing our own inner work. And I want to begin with probably my favorite quote, or one of my favorite quotes, and that's from Pema Chodron, who's a Buddhist teacher, from her book, The Places That Scare You. Compassion is not a relationship between the healer and the wounded. It's a relationship between equals. Only when we know our own darkness well can we be present with the darkness of others. Compassion becomes real when we recognize our shared humanity. So for me, this work, ultimately, what I recognize is ultimately, in order to assist patients in going deeper or deepening this treatment paradigm, it is paramount that I and that each of us do our own inner work. Because what I have experienced is we really can only, and I wrote take a client, but I would say assist a patient in going deeper. We're not going to be able to assist them in going any deeper than we're willing to go ourselves. And if we don't do our own inner work, which is continually evolving, the work, as we know, is an ongoing process. If I'm not willing to do my own inner work, then I will consciously or unconsciously prevent our patients from going deeper and getting into some of this core material. So quite simply said, a patient cannot possibly evolve past our own level of awareness and understanding. And so when I talked earlier in the webinar about creating the field of presence, that field of presence cannot be a clean or clear, open presence when I'm bringing my stuff into the room. And of course, what we know is that it is a process, and on some level, there's always some degree of our stuff in the room. But the invitation is to do our own deeper inner work so that we can be a field of presence, and we can allow ourselves and allow our patients to go deeper. So thank you so much. I'm so grateful to have been a part of this webinar. I know we're going to do question and answers, and I'm really grateful for all of you for your presence here and what we've discussed in deepening the treatment paradigm.
Wonderful. Thanks so much, TJ. Before we get into the Q&A portion of today's event, I would like now to hand things over to Leah Boone from Foundations for a few words from our sponsor. Leah?
Here at Foundations Recovery Network, our grassroots movement called Heroes in Recovery has a simple mission: to eliminate the social stigma that keeps addicted individuals from seeking help, to share stories of recovery for the purpose of encouragement and inspiration, and to create an engaged, sober community that empowers people to get involved, give back, and live healthy, active lives. Join us in this mission at our 6K race series at these locations across the country. As a thank you for your attendance today, please enjoy the discount code Webinar 2016 to register for any future 6K event. Back to you, Julie.
Great, thanks so much. We have had a number of questions come in from the audience, but we'd like to remind you that you can use the Q&A widget below the slides on your screen to submit a question at any time. All right, TJ, let's dig in. We've had some good ones come in. Someone in our audience is asking, how do you recommend addressing spirituality for a client who just doesn't believe in the concept?
This is such a wonderful question, and I would say, the overarching principle is meeting them where they're at. As I was a spiritual director of a residential program, as the spiritual care coordinator at Foundations IOP in San Francisco, we really, it is important that we allow them to have whatever their own belief or experience is. I will often speak with patients about the difference between religion and spirituality. I think it's fundamental because so many of our patients, or many of our patients, have had maybe a negative experience of religious, sometimes even abuse early on, and there needs to be some healing there. So assisting them in, what I do is simply ask them what's the difference between religion and spirituality. I allow them to give their framework, and then after that I say, based on that, might spirituality play a role in your recovery? And when they're able to separate religion and spirituality, they're most always, by their own definition of spirituality, they recognize that there's something useful for them. Of course, we also have many clients who are devoutly religious and they practice their religion, and we honor and celebrate that as well. But for those patients that are really struggling with this idea, it's really paramount that we ask them their own definition of spirituality, and then from there, simply asking them, might that help you in your recovery? And I've found really wonderful results from that.
Wow, that's a really great tip. Thank you for that. And someone in our audience is asking about mindfulness. Have you used a mindfulness technique, and what has been your experience with that?
Well, as we know, mindfulness is now, really all the rage, if you will, because it's highly effective. We see, large corporations doing mindfulness now. We see mindfulness in schools, and of course we see mindfulness in our treatment programs, and it is highly, highly effective. I actually open all of my groups that I facilitate with a 10-minute mindfulness process. It's a simple process of assisting our clients to go within. I just listened to this wonderful interview. Lee Pepper interviewed Noah Levine at one of the Foundation events, and one of the things that stood out to me that's so powerful, and I think it's a framework that we can really use to assist our patients, is the goal of mindfulness or meditation is not to quiet the mind. It's to learn to recognize that the mind does what it does. And the way I say it, and actually the way Noah Levine said it as well, is the mind's role is to think, just like the lungs' role is to breathe and the heart's role is to pump blood. So it's not about quieting the mind. It's about, Noah Levine actually says ignore the mind is the first step and return to the breath. So assisting our clients in that simple framework and offering them a way to become present in their body. And then the next step, of course, is to become aware of the mind rather than being caught in believing that we are our thoughts. So mindfulness is an incredibly powerful tool. And if you're not personally comfortable with mindfulness, there are so many mindfulness meditations you can get online. And you can just either use one of those meditations or you can play one on YouTube. And it's incredibly effective in helping our patients.
Great. Now, we've talked about mindfulness and we've talked about spirituality. Someone in our audience is also asking about cultures. Do you have any tips for working with people of various cultures who might have certain beliefs that they've held on to for a long time?
Absolutely. I think we kind of addressed that in the first question with, certainly religious beliefs and cultural beliefs. I think it's really important, as we know as clinicians, to really be open and understand how different cultures approach, different aspects, whether it's spirituality or addiction or relationships. Part of it for me, again, is assisting someone in, and I want to be careful the way I say this, but moving beyond some of the cultural norms. And I don't mean, we certainly don't discount cultural norms, but where I'm going with this is essentially at our core, in my experience, we all really want the same things, right? We all really want love and connection. In working with clients from different cultures, it's incredibly important to honor their culture, honor their history, and assist them in either embracing that or making peace with that, whatever work they need to do, and also recognize that essentially we're all more the same than we are different.
Great. Well, let's see if we can finish up with one quick question. You had talked about doing our own inner work. Can you give an example of what that might be?
Well, absolutely. I mean, for me, it's been therapy, my own therapy, and then also my own mindfulness practice, my own spiritual journey. I recognize that I need to take time in retreat, so that might mean an actual retreat, spending time in the silence. And also, I think another way to frame this is creating a team. One of the things that I feel so blessed to work at Foundation's San Francisco IOP. Our director, Melissa Stevenson, is so incredibly gifted at creating a safe space in our team for us to be able to be vulnerable and bring our own authenticity into the room with the team and create a safe space where it is okay for us to talk about our own transfers, to talk about our own resistance. And all of that safety that gets created in a team can also be a really incredibly powerful way to do our deeper inner work. So it happens individually for myself in my own therapy. It happens in mindfulness practices for me and in spending time in meditation and in the silence, and then also being part of creating a team that allows that vulnerability and authenticity into the room.
Great, thank you. Well, I know that time definitely goes fast, and unfortunately that is all the time that we have for questions today. But we do have some final instructions for you regarding your CE credit. And again, if you have any issues with this process, please don't reach out to today's sponsor. They won't be able to help you. To receive your certificate for today's program, you must click on the green Program Evaluation, complete the evaluation form, and click Submit. For those of you watching in a group today, please remember to download the group submission guide and the program evaluation, which you will find located in the resources area, and follow the instructions provided. If you're watching today from a mobile device or from a tablet, you'll need to email the help desk to receive the program evaluation and to get your certificate for this program. Also, please note that CE credit is not available for the archived webinar. It is only available for the live event today. If you have any questions, just go ahead and click Contact Webinar Help Desk in purple at the bottom of the screen. Also, if you enjoyed today's program, please join us again on Monday, February 29th for our upcoming Addiction Professional Webinar sponsored by Foundation's Recovery Network along with Vallejo Resources Behavioral Health Recruiting. That program is Overlooked Taboo in Addiction Treatment, Our Relationship with Money. The program will be presented by Paige Armstrong. A link to register for that program is located in the resources box on the left of your screen. And again, I would like to thank TJ Woodward for an excellent presentation today. I would also like to thank Vallejo Resources for making today's Foundation Recovery Network program possible. Finally, thank you to everyone in our audience for participating today. We hope that you'll join us again in the future for another Addiction Professional webinar. This concludes today's presentation.